you have discovered in your research that there's a very high risk or a high incidence of undiagnosed tuberculosis among prison inmates who are just entering prison who have HIV. What is it exactly you were doing there, and what kind of threat does this pose?
Right, so we have started actually a very large project in Malaysian correctional system, that we start actually from a simple screening for people who are inside the prison for tuberculosis. And we found actually high prevalence of active TB of people inside the prison. And we thought that probably the people actually coming to the prison bringing the tuberculosis with them. So we screened actually all HIV-infected people entering inside the prison for tuberculosis using sophisticated novel diagnostic tools, including Gene Expert. That's the newly introduced in the prison. And we found actually shockingly very high prevalence of active TB among those prisoners with HIV infection who hasn't been diagnosed before. This means that it was missed by the healthcare system outside before entering in the prison.
Because prison is a place where you can easily get TB, isn't it? What are the risk factors?
Well, we know actually that from many historical studies in many countries actually that TB is very high in the prison setting, and we know that actually prison might work actually as reservoir, augmenting tuberculosis transmission within the prisoners and also to the general population. So WHO actually give an estimate that up to 100 times higher active TB disease in the prison compared to the general population.
What lessons do we learn from your research?
I think the most important thing actually from my research that people actually entering inside the prison, they have high prevalence of active TB disease. And what we need to do actually to establish actually a sentinel program upon entry to the prison to all prisoners. Because at the same point that prison might increase TB, at the same time actually it's a very good health promotion area. Well, all the prisoners are there, and then we can actually diagnose them with active TB, we can give them treatment, and they can finish their treatment while inside the prison.
Bearing in mind the fact that many of these prisoners are co-infected with HIV
right.
and TB,
yes.
Are there any special concerns about combining the treatment and integrating it so that it is optimal?
I agree actually. It's one of the major challenges that we're facing right now, because according to the WHO that all HIV infected people with active TB disease, they need to be put on antiretroviral therapy. And we're facing major problem right now of scaling up this so that all of them, they can get actually the antiretroviral therapy. It's a major challenge, of course, for us right now.
Does that interfere with the TB therapy, and what about drug-resistant TB?
So it's not actually. We sometimes actually have some drug-drug interaction, but generally it's well tolerated, and we have many actually examples from other countries that it's well tolerated to give both medications at the same time. For drug resistance, actually we haven't discovered cases of drug resistance inside the prison. So we don't have actually any MDR TB for now, knowing actually Malaysia is a country with a very low prevalence of MDR TB in the community.
Now, you described this as an alarmingly high incidence.
Right.
What is, briefly, your call to action?
I think, as I said, actually the most important thing actually to establish a proper TB control program upon entry to prison, not only to Malaysia. We know actually the region, the Asia Pacific, that it's very limited. We don't have any data from other countries that they offer TB screening upon entry to the prison. So the most important thing actually, we need to establish an active case finding upon entry to the prison, particularly targeting HIV infected people, because they're a special population. The risk is very high, the mortality is very high among this population.
Thank you very much.
Thank you, sir.